Before modern hospitals, before anesthesia, before anyone truly understood the human brain, there were healers with stone tools and enormous courage. They believed pain, madness, and disease came from something trapped inside the skull, and the only way to set it free was to cut a hole through bone. This ancient procedure was called trepanation, and it stands as one of the oldest and strangest surgeries in human history. Archaeologists have uncovered skulls more than 7,000 years old, scattered across Africa, Europe, and South America, each bearing the same circular hole. Some skulls even show clear signs of healing, proving the patient survived. Imagine surviving that. No painkillers, no sterile rooms, only primitive tools and sheer will. To these early surgeons, success wasn't luck. It was proof their method worked. So why do it? In ancient cultures, illness was often seen as spiritual punishment or demonic possession. If someone heard voices or suffered seizures, healers believed evil spirits were trapped inside the head. Cutting an opening would release them. In Peru, shamans performed trepanations as part of sacred healing rituals, chanting to guide the spirit's escape. In Greece, physicians influenced by Hippocrates used it for head trauma after battle. Now picture the scene. A patient sits still, surrounded by smoke, herbs, and whispered prayers. A healer presses a sharpened stone or bronze knife against the skull and begins to twist, scrape, and grind in small circles. Each movement cuts deeper, bone dust falls. The sound is a slow, grating rhythm between breaths. It could take hours. Sometimes the patient passed out, sometimes not. When the final thin layer gave way, the healer stopped, wiped the blood, and applied crushed herbs or honey to prevent infection. No machines, no gloves, just instinct, courage, and a faith stronger than fear. What's truly astonishing is how many patients lived. Healers learned to avoid the brain's soft tissue, targeting only the bone. In some regions, survival rates were higher than early European battlefield surgeries, done thousands of years later. That means ancient healers, without microscopes or anatomy charts, understood something about human resilience that science would rediscover centuries later. You might think this practice vanished with time, but it didn't. Through the Middle Ages, doctors used trepanation to treat epilepsy, migraines, and even depression. In the 1800s, surgeons used refined drills, convinced they were relieving pressure on the brain. Even stranger, a small modern community still believes trepanation can expand consciousness by improving blood flow to the brain. It's fringe science, but it shows the same fascination with unlocking what's hidden inside our heads. Trepanation tells a story bigger than ancient surgery. It's about human curiosity. Our ancestors were desperate to heal, to understand, to control what they couldn't see. They risked everything for knowledge, even when that knowledge was wrapped in superstition. From stone tools to scalpels, from ritual to science, the desire to heal has never changed. This was trepanation, one of the most bizarre medical practices in history. Next time, we'll explore how leeches and worms became medicine's most unlikely heroes. Make sure to subscribe, because the past still has plenty of strange cures to uncover.